Kidney cancers are silent cancers. Most of the time, the kidney cancers are detected when the patient comes to the hospital for some other reason. When the doctor conducts an ultrasound or a CT, most of the time we come to know that the patient is having a kidney cancer. It does not produce any symptoms till it grows to a large extent, to a larger size. Otherwise, it will remain silent in the body and will not cause any symptoms. Now, 95% of the cancers are sporadic, which means they are not associated with familial conditions or hereditary conditions. Only 5% are hereditary cancers. There are certain risk factors associated with kidney cancers. One, which is the most important, is the obesity. Most of these patients are having a BMI of more than 30. So obesity is a very strong predictor of kidney cancer. Second is high salt intake and hypertension. Third is smoking. Fourth is the family history of kidney cancers. So as I said, the symptoms of the kidney cancer, it remains asymptomatic. It does not produce any symptoms. However, it can produce some symptoms like backache, or if it is grown to a bigger extent, it can cause hematuria, which is the blood in the urine. And if it is gone into a further advanced stage, it can go into the lungs and it can have some lung issues as well. Now, how do we diagnose kidney cancers? So diagnosis of kidney cancer is usually done by doing an ultrasound, and if it shows a kidney lesion, we proceed to do a CT scan and a battery of other blood tests. If we suspect that it has gone to the other organs, probably we would go for a PET CT also. To diagnose kidney cancers, normally we do an ultrasound scan, and if it shows a mass lesion in the kidney, we'll go for a CT scan of the abdomen and pelvis. Again, if we suspect, we will go for a chest CT to look for the metastasis in the lungs. Now, the treatment part of the kidney cancers. Kidney cancers are usually radio-resistant, that means the radiation doesn't work. They are usually chemo-resistant, that means the chemotherapies don't work. The only treatment is to pick it up in the early stages and do surgery. That means we have to remove the tumor, either only the tumor or the kidney as a whole. So the treatment of kidney cancers, depending upon the size and location of the tumor, we decide upon the type of surgery which a patient would require. Whether he requires a partial nephrectomy or a radical nephrectomy, that we would decide upon by looking at the CT scan. Partial nephrectomy can be done either by an open method or by a laparoscopy or by a robot. Robot offers advantages over the other two. So in the end, I would like to advise you all, please stop smoking, reduce your weight, engage yourself in active physical activity, keep yourself well hydrated, and please undergo health checkups to detect kidney cancers.